There's been a steady increase in COVID-19 cases reported among young adults from the age of 18 to 22. Young adults, including those enrolled in colleges and universities, should take precautions including mask wearing, social distancing, and hand hygiene.
It is very likely that you or someone you know will be exposed to and or test positive for COVID-19. It is also important to first visit the LSUS website and report your case, and then follow the instructions.
Next, it is important to understand what it means and what you should do if you are asked to adhere to quarantine or isolation once you've reported your case. Quarantine keeps someone who was in closer contact with somebody who has had COVID-19 away from others. If you've had close contact with the person who has had COVID-19, stay home for 14 days until after your last contact, check your temperature twice a day and watch for symptoms of COVID-19. If possible, stay away from people who are at higher risk from getting sick from COVID-19, and remember, you cannot test to shorten your quarantine period.
Isolation keeps someone who is sick or think they have tested positive for COVID-19 away from others, even in their own home. If you are sick and think or know you have COVID-19, stay home until at least 10 days after symptoms appear. At least 24 hours with no fever without fever-reducing medication, and until symptoms have improved. If you tested positive for COVID-19 but do not have symptoms, stay home at least 10 days after your positive test. If you live with others, stay in a specific sick room or an area where there are no people or pets. Use a separate restroom if available.
Thank you again for fully participating in quarantine and isolation when asked. It is a meaningful and effective way to contribute to the safety of our entire LSUS community.